Hi, my name is Leanne McNall, and I'm just going to give an elevator speech of what the role of the nurse practitioner is. Um, so the first question that I'm going to answer is what is a nurse practitioner? So a nurse practitioner is an RN in an advanced role. Um, so some of the things that nurse practitioners do is they do assessments of a patient, they diagnose, they also use non-pharmacological and pharmacological, um, I would say, medications or prescriptions to manage disease states or pain. And then they also they complete or they plan for they make a plan of care for the patient. So um, some things. There are a couple of things that nurse practitioners need to have in order to be a nurse practitioner. So you have to have your RN. Some states you can still just have the associate degree, which is a 2-year program to get your RN, which you sit for that boards. But most of, like in Massachusetts, most hospitals and there are a lot of programs, you have to have your Bachelor of Science of Nursing. So with either of those two degrees, you then have to sit for this board of tests. So that once you become a nurse, so an RN, you then can go to a graduate program where you'll get your MSN to become a nurse practitioner. So that's the educational requirement. And then you need to be, after you graduate from that master program, you have to be nationally board certified. Um, so that way you can practice in primary care. There is an acute care board certification for some specialties, so NPs can do that as well. Um, you need to have possession of advanced clinical knowledge. So that means that they need to have not just the knowledge that the RN has, but they need to have the critical thinking piece. That's a huge part of taking that assessment, taking lab findings and other diagnostic findings, and then creating a diagnosis, and then from that diagnosis, making a prescription for that patient. And then you're always an RN first, so that means like everything that you learn as an RN, you build onto that as an advanced practitioner. So that's what an NP does, is they take that theology. It's like a holistic view of the patient. So NPs not only, they don't just look at the patient on a medical stance, they're going to try to take care of the emotional needs, the psychological needs of a patient, not just the medical pathology, basically. And then, especially with just nurse practitioners, they need education because they do a lot of health promotion, and that's why they work in a lot of primary care settings. So, yeah, that's basically it for a nurse practitioner. Um, Now, if we're gonna go look at what's the difference between an NP and a PA, which is something that I know a lot of people that are second-year students that have gone back, or adult students have gone back to school. A lot of people I knew wanted to be PAs and then switched to NPs because there is a definite difference between both. So NPs and PAs can do the same exact thing. The main difference between them is that PAs, they do have to be licensed, but they are licensed to work underneath a physician. So they have this autonomy to make assessments, make diagnoses, but it's all it has to be okayed by a physician, or they work like together with a physician. With a physician team. Different specialties like orthopedics or ED, they definitely have a lot more autonomy, but for the most part, that's what their scope of practice is. Nurse practitioners are considered independent prescribers. So basically, NPs can open their own practice where a PA could not. Up until, I think it was this past year, actually, nurse practitioners could not open their own practice in Massachusetts, but that was just passed. So there's only a couple more states. Actually, there are a bunch more states, but I know that we were the last state in New England for that to happen. So basically, you have to work for 2 years, and then you can open your own practice once you've worked as an NP for 2 years, alongside of a physician or another, type of group, team, physician group. So that is the main difference between a PA and an NP. The other thing is the education piece. So PA students go to school. They either go to school for a 2 or 3 year program, and it is all about disease pathology. So, and then they go straight into clinicals, and their clinicals are tiny microcosms of what they may or may not end up doing. So much of what they do with the patient is it's like a narrow shot of the patient. So they're looking at the disease pathology and how to treat that. Whereas an NP, because we have the background that we do, we look at the patient and know that there are multiple things that could be adding to that one disease state. That is why the patient came into the office or came into the hospital or had an acute episode of something. So that's a big difference between PAs and NPs. Not that there's nothing wrong with the role of the PA. That's just that's also a reason I decided to go to NP school instead of PA school, because I liked the holistic view of the patient. And then the next thing we're going to talk about is what is the difference between a nurse practitioner and a physician. So NPs and physicians, they actually do have the same role. So they can both prescribe, they assess, they diagnose. There's a couple big differences, as you know, but NPs, the school is a lot shorter. So you need your bachelor's, and then you need your master's. So it could be, I would say 8 years max, and so that's less, money for you to pay to go to school. Doctors, they have to get their bachelor's degree, then they have to go to 4 years of medical school, and then they do residency, which is usually 3 to 4 years. And if you want to go into a specialty or a fellowship, that's 2 or 3 more years. If you go into surgery, that's like another. So it could be up to like 11 to 15 years of schooling just to walk in the door and, be able to open your own practice or to practice medicine as an attending. So that the education's a lot different and longer. The other thing, which I didn't know, is that I thought NPs could prescribe any drug on their own, but I looked up in Massachusetts, and there is a statute. There's a lot of litigation, but there's something called prescriptive authority, and I think it's substance 2, 3, and 6 category drugs. NPs are not allowed to prescribe on their own, which I did not know that. So there's a group of that substance list of there's categories, and NPs are not allowed on their own. It has to be a collaborative prescription in order for that patient to get those substance level drugs, which I didn't know. I thought that I know that NPs get a narcotic license number just as a physician does, but that's something I just learned through this class, actually, in an article that I found on mass.gov. So that is a big thing. So overall, and through history, and what I was learning is that there's kind of always been this kind of power surge or struggle for RNs, where physicians wanted, there was needed tasks and roles that needed to be done, but there weren't enough doctors, and so the doctors wanted nurses to take in more advanced roles. So nurses always do what needs to be done, And that's what one of our books was talking about, and which I thought was really interesting. And so I think nurses are always kind of, nurse practitioners and being the nurse first are always on their toes to try to figure out how they can help the system versus this like power authority struggle. And sometimes I think, even within Massachusetts, nurse practitioners weren't allowed to open their own practice up until I think it was a year ago that the law just passed. So it's a big deal that we're making moves and we're progressing and we're getting more autonomy. So that's the biggest differences I can really think of NPs and doctors. The other main thing is the theology piece, and it kind of a needs piece. When the Affordable Care Act came out, there was a huge need for nurse practitioners because there was all of these people going to get health care that we didn't, expect, and there were masses of people getting insured, so they were going to get health care. And so primary care is the main place that NPs practice because that's where the need is. And physicians are treating more acute illnesses and complex, medical issues. It doesn't mean that NPs can't practice in acute care. I mean, myself, I would love to be an acute care pediatric nurse practitioner, but we are primary care based, and you have to be board certified to practice in acute care if you're an NP. So there's primary care and acute. Whereas physicians, a lot of them, some of them do have their own primary care offices and they work outpatient, but a lot of physicians who are looking at complex medical cases and trying to figure out what the best plan of care for the patient is the physician. It usually isn't the nurse practitioner. Doesn't mean that NPs can't work together with the physicians, but it's usually the physicians on those really complex cases. And I think that's all that is of looking at the difference between their roles. And then, so the last question is why wouldn't everyone just go to medical school or become a doctor? And the reason is, one, it's super expensive. I looked at this data and it said that, it's basically, it can be like maybe like 3/4 or half of the time to get your master's and to practice as a nurse practitioner, which means it's less money to go to school. And for doctors, one, during residency, they don't get paid that much, and two, it's just more school throughout. They're just in school for a longer amount of years, and they're not getting paid that full salary. So that's one thing. And then the other thing is, we're basically, from my analysis, NPs are basically doing the same thing. It's just a different viewpoint. So I think it makes sense if you want to have a family and, there's other things other than just, going to medical school and being a doctor, because by the time you're in a doctor, even if you started in your 20s, you're in your, 30s or, mid 30s, just like starting your career. And there's a whole other part of life that's not just, it's not just, work or, becoming a doctor and helping people. I think the other thing is that the way I've talked to a lot of doctors, I actually work with a physician, and she's an attending I work with her at Tufts, and she had the option to go to NP school or go become a doctor. And she always tells me, looking back now, she wished she went to NP school because she has all this debt. And she said the only thing that she really learned and that she uses is when she was in practice in residency, and medical school was just a bunch of memorization, and then it was gone. So I think the difference is with NP school, there's a lot of theology of practice, but we're also doing practice and then we're doing clinical, and they work together. So we're really getting to the nitty-gritty of what we really need to know on a clinical level, and then emotional level, and we're meeting all the needs that Maslow's hierarchy of needs of the patients. Whereas doctors, even though they go through all of the school, sometimes they can't meet all the needs of the patient because that's not what they were taught in practice, and they only learn meeting the needs depending on their mentorship or what type of field they're in if they're in their residency program. So it's just a different it's a different education process, and it's just like a different perspective. So I think on that level, I think it makes so much sense to become a nurse practitioner because, as an RN, you do put like a million different hats on and you're doing that, but that's kind of the same thing that you're doing as an NP. You're not in with the patient as much as you would be with the nurse. The nurse is in a lot with the patient and knows most about the patient, but you're still coordinating all their care, and you may have to, talk to other professionals that maybe the doctor wouldn't, because you want to make sure you're meeting all the needs, not just prescribing them, a drug that's going to take away pain, or, or something that, is going to affect their lab values. Like it's just different. So that is my analysis of why you shouldn't just go to med school. And I think a lot of other people feel like that. I think that's why a lot of people are going back to school to become nurse practitioners. And I think it's a great job outlook. So, yeah. So just from my analysis from over time, and I've been looking and, reading in one of our, books, is that there's just been this like need, and nurses seem to be able to do a bunch of different things and do it well, and they have this kind of general knowledge, and physicians needed nurses to do more, and so then the advanced practice role became a thing, and now we're here and we're still pushing it to the max. So it's very exciting to become a nurse practitioner in this time. So yeah, that's it.